So one of the questions I'm commonly asked is, why should I go see a chiropractor instead of an MD or an orthopedic surgeon? The biggest answer is because our central nervous system controls everything that's going on in our body. We have 3 trillion inputs coming into our brain every second, and those inputs, the conduit for those inputs coming into our brain is our spine and our nervous system. When all these messages go through our spine, they have us either function or not function properly. So when somebody is experiencing a problem such as low back pain or they're experiencing neck pain, oftentimes that pain is coming as a dysfunction because the joints in the spine are no longer moving well. When there is no motion, there is pain. When there is motion, there isn't pain. There are 3 nerve fibers within our body that sense motion and joint position, and one of those focuses on pain. So there are 3 mechanoreceptors, which are joint position fibers, and there is one type of nerve cell that's called a nociceptor. When the mechanoreceptors are firing, in other words, when there is motion to the spine, then the nociceptors, which experience pain or which project the feeling of pain, are quiet, and vice versa. So when somebody is experiencing a problem like low back pain or neck pain, they need to restore the motion to the joints of their spine so that the mechanoreceptors can quiet the nociceptors. That's a whole lot of technical jargon for chiropractors. Work with the joints in the spine. Orthopedic surgeons fix broken joints. Long before a joint is ever broken, there is the possibility that the chiropractor can restore motion. So by looking and taking x-rays of the spine and the extremities of the spine, the chiropractor can assess where motion has been lost, and by restoring that motion to the spine, alleviate pain from the spine. This is done without drugs. This is done without surgery. The body is a self-healing, self-regulating mechanism. The body knows how to heal. What we need to do is give the body something to allow it to heal with. Sometimes that is just lost motion. Sometimes that is nutrition. Sometimes the body needs both. But the number one step is to take a look at the nervous system, which keeps the body alive, and determine whether there is interference to that system. If interference exists at that system, the body, the human body, cannot express itself as a vital organism. The biggest difference between chiropractors and orthopedic surgeons is our entire focus. When a chiropractor looks at the body, when I look at the body, I look to the body to find out where has it lost motion. What is the body supposed to do that it is no longer doing properly? An orthopedic surgeon looks to fix the body by altering the body. When an orthopedic surgeon works on a knee or an orthopedic surgeon works on the lower back, they are actually physically changing the body. They are cutting into the tissues to fix a problem that they see. A chiropractor is merely restoring motion without altering the joint tissues. The long and the short of it, this restores the proper input to the central nervous system that will allow the body to express a symptom other than pain.